Okay, so thank you so much, Kaitlyn, for joining us, or I should say Dr. Kaitlyn, for joining us today. And then Carrie, my sister, and our wonderful operations manager at Fit Family is also joining us. So Kaitlyn, thanks again so much. We're so excited to hear your wealth of knowledge, and just what else can you tell us about pelvic floor physical therapy? But first, give us a little bit of information about yourself to start things off.
Sure. So my name is Dr. Kaitlyn Kakar. Thank you guys so much for having me on the podcast today. I am so excited. So I'm a pelvic health physical therapist. That means I treat anything related to the pelvic floor. And for those of you watching this, I'm just going to show you a quick snippet of where your pelvic floor muscles are. If you're just listening to this, I'll make sure to give a good description. So just real briefly, your pelvic floor muscles are a group of muscles that sit at the bottom of your pelvis. They span from side to side where your two sit bones are, from the front at the pubic bone, all the way to the tailbone in the back. So these muscles have a lot of really important functions as it relates to maintaining continence, meaning not leaking urine or stool, aids in sexual function, helps provide stability to your body. So that means when your arms and legs are moving, the pelvic floor provides that bottom part of the stability of the whole core system. And then, of course, it supports your bowel, your bladder, and your uterus. So if you can imagine anything that is dysfunctional in this area, that's what a pelvic health physical therapist treats. I'm a little bit unique in the niche that I'm kind of in because I treat mainly pregnant and postpartum moms. So anything that relates to the pelvic floor when you're pregnant or postpartum, that's my jam. That's what I treat. So I started off as an orthopedic physical therapist in a really big outpatient orthopedic clinic. Then I moved over to Australia. I was a physiotherapist over there. And so that's where I really learned all about pregnancy and postpartum and really discovered a love for that population. Then I got pregnant and I went through my own pregnancy and postpartum journey. And wow, my eyes
The
were
best kind of
open
experience.
literally, my eyes were really open to just that lack of knowledge, support, guidance, resources that were out there for moms. So I have made it my mission and my goal to educate as many moms as possible on what's normal, what's not normal, what you can expect through pregnancy, what does birth look like, how can we prepare for that, what are these pelvic floor muscles that people might hear about but they don't know exactly where they are, and then postpartum, how to heal your body, how to recover, how to get back to doing all the things that you want to do. So I never said I was going to start my own business or be a business owner, but that passion for getting this knowledge out there and treating that population has definitely kept me going. So now I have a second daughter as well, and the business is growing. I'm so excited to treat as many moms as I can in the Valley and also virtually.
That is awesome.
That's just kind of a little bit about my background, kind of how I got to be here.
I love that. You can like feel the passion pulsing through you, which is like exactly what you need for someone helping you during pregnancy or postpartum. I love that.
And there's a lot to unpack in what you just said. First of all, I'm super pumped that you brought a pelvic model to us. That is just awesome. That is how pumped Kaitlyn is on her specific journey in physical therapy. But I have a few questions. So talk to us a little bit about, you said you were kind of inspired when you went to Australia, which is awesome. Tell us a little bit about that and kind of what specifically led you to discovering that pregnancy, prenatal, postpartum world that maybe was a little bit underserved and there was a need there.
Definitely. So it was kind of cool going over to Australia because I could then call myself a physiotherapist, which feel it sounds so much cooler than just a physical therapist.
It does.
So one, I loved being able to be called that.
We need to get America on that game, on that track.
Yeah, right? I know. I mean,
sounds so much higher education and everything like that. Yeah.
Just like more refined, maybe.
Yes. One word. We like the one word.
Exactly. So the clinic that I was at just so happened that they treated a really big population of pregnant and postpartum moms. I kind of fell into that. I didn't necessarily go out in search for that, but they also treated orthopedics, which that was my jam at that point. But the other cool thing about the clinic that I was in, they did a lot of Pilates. And so over in Australia, physio and Pilates are very much intertwined. So the thing that I liked about Pilates was it brought so much awareness to core and posture, two things that are so important through pregnancy and postpartum. And I learned a lot from one of the other physios there who did more of the pelvic health, pelvic floor side of things there. And so it was just, I mean, as eye-opening as it was for myself to go through the process, I just kept hearing it mom after mom after mom. Why didn't I know this? Why does nobody talk about this? How was I supposed to know that this or that could happen? And I was like frustrated by our profession that we haven't done more.
One thing that you said, and I definitely, I'm trying to think of analogies for people to understand this process of like a referral to a pelvic health physical therapist is, in the same sense, it's like an OB is looking, is the tissue that we worked on healed? Yes. It's the same as maybe a patient who went to have an ACL reconstruction. They're going in, that surgeon saying the graft is intact. It looks great. The screws are in the right place. But in their sense, and this is why we need collaboration, is their job is done in that sense. Of course, they care about the patient's long-term outcome. Many, that's still something at the forefront of their mind. I don't want to discredit those providers in that sense. But I think in their sense, that's what they're looking at. That's what they're trained. And that's why we need a little bit more collaboration. But it's the same for OB, right? They see the tissue and they're thinking, oh, this looks good. I don't see signs of infection. Everything's intact in the way it should be. But we forget that, our pelvic floor is not just active in giving birth and things like that. We're using it on a regular basis for things as simple as breathing and using the restroom, which all of us do multiple times a day. So I think in that sense, that's a good analogy to look at, is like, maybe that's where the disconnect is. Then the other thing I would say, and I'll let you guys comment on this as well, is like, I think in the United States, we're still in a little bit of the treatment model and instead of the prevention model. And so if there's not, it's like, if it ain't broke, then why do we need to fix it? But I think we need to maybe shift our definition of broke in that sense. And instead of just looking anatomically, is it broken? But like, what about functionally? Is it broken?
Well, I would agree with that. And then I would say, I mean, I know this is diving into a little bit deeper of a healthcare discussion, but I do think the prominence or prevalence of direct pay, like your business, cash pay services, concierge medical services, also makes this more accessible for people who just want the education. And maybe that's even before they have a baby, or pre-pregnancy, or pre-labor, where it's like, yeah, technically there's no referral warranted from your birth provider. There's nothing wrong. But it allows people like myself, who did get pelvic floor physical therapy from Kaitlyn, to seek it out when you want it, and to be able to directly access that, I do think makes it that's my thoughts on why it might be becoming something that more and more moms are seeking.
Yeah, Kaitlyn, can you jump on that and just explain kind of like your the way your practice works? I think that would be great for listeners to hear about how they can access you and why it might be a little bit easier than they think.
Yep, 100%. So in the state of Arizona, we are direct access, meaning you can come directly to us for physical therapy services. You don't need a referral. So I chose to make my practice cash-based because insurance companies often do not cover the things that most moms want to be coming in for. So as we know, physical therapy, when it's being reimbursed by an insurance company, is very functional based. Can you get out of bed? Can you do your day-to-day activities? It doesn't necessarily cover for, do you want to get back to running at a high level? Do you want to be able to exercise the way you want to be able to? Do you want more of that preventative education about how to prepare your body for birth? So that's why I want to be able to treat my patients the way I want to treat them for their goals and their concerns and things that they want to learn.
Okay, we're back. I wanted to pinpoint one thing you said, which I think a lot of people don't understand when they're seeking any kind of physical therapy, but for sure with pelvic health physical therapy, is that insurance companies are not always going to reimburse or support your attendance of physical therapy if you are already doing what the normal individual is doing on a regular basis, i.e., walking, using stairs, which most people are not seeking, as you said, for those reasons. They're seeking out support and education to help them get back into a strength training program that they maybe were doing prior to this. Unfortunately, that higher level of physical functional activity is not always recognized in sense of like a need for physical therapy. So, and I'm sure for you, you see that all the time because moms are generally fairly healthy if they can if they can get through birth, they can get through a lot of things. It's quite a physical event in itself. So yeah, talk a little bit more about that and what kinds, what's the spectrum of patients you're seeing postpartum and prenatally, any of those.
So I usually
areas.
recommend for most moms, and I think something that's kind of eye-opening, I think there's a wide range of what some moms know and what other moms don't know. So I always like to give the recommendation for if you're pregnant, you're not having any symptoms. So you're not dealing with back pain or neck pain, no pubic symphysis pain, round ligament pain. You're not having any leaking, pressure, heaviness. So you're relatively symptom-free. I still recommend.
I feel like that's nearly impossible
right?
during pregnancy. You've got to check one of those boxes.
Exactly. Usually something in there, people will be like, okay, yeah, you're right. I do have a little bit of low back pain that I'm dealing
sorry
with.
to interrupt
No, not at all. I always say come for at least 2 visits. And so I usually recommend one in your second trimester. And that's the time that we'll go over and talk about things like what's happening with your body during pregnancy. Like as your belly starts to grow, baby gets bigger, it's pushing up on your diaphragm. It's going to affect how you're breathing, which is going to affect your whole core system. So the diaphragm, the abdominal muscles, the pelvic floor muscles, the back muscles. What's normal for your abdominal muscles to stretch? Like a lot of moms don't know that a diastasis recti, that's normal. Your belly needs to grow and stretch. So you're going to have some degree of that diastasis. However, there are things that we can do that are going to prevent the severity of it and to help recovery be a little bit better from that standpoint. We'll talk about pelvic.
See, I'm learning here. I feel like I didn't know that it's totally normal to have some degree of separation there.
And I always drive home the point too.
That's great to know.
Nothing is splitting. Nothing is tearing. It's just that connective tissue that's lengthening and stretching. So I think some moms get scared to move or to do anything because they're like, I don't want my abdominals to split. And it's like, they're not splitting. They're just kind of opening up, I like to say. They're allowing room for baby. They're allowing that growth to happen. But yeah, there are some things that we can do that are going to prevent the severity of that from happening. The other thing we'll talk about a lot is kind of what that pelvic floor is in relation to birth. So there's also a lot of myths out there of, I need a really strong pelvic floor to help push the baby out. So those pelvic floor muscles aren't pushing the baby out. Those pelvic floor muscles need to get out of the way. They need to lengthen and relax to allow a baby's head to come out. So yes, you do need the proper strength because as baby grows, there's that extra added weight on the pelvic floor muscles, and they do need to be able to respond and still have some strength there. But then once we get closer to birth, we need to practice what it feels like to let those muscles relax and let go. And so once we get into that 3rd trimester, we'll talk a lot about birth prep, what positions you can labor in, what positions you can push in, what are some proper pushing techniques, how does that tie into your breathing, what does that mean for your pelvic floor, what does that mean for your abdominals. So the more education that we can get out there surrounding pregnancy and birth really do help make postpartum a much easier experience. I mean, there's always a challenge there. There's always that recovery that needs to happen and take place. But I think the more that you can know up front is going to really help set you up for that postpartum period. And so we'll also spend some time in that 3rd or that 2nd visit to talk about what that looks like, maybe some good products that you want to get and have on hand. What's the proper position for your body to be in to have a bowel movement or to, you know, to urinate? How can we support that healing with ice and elevation? So kind of, even if we go back to that ACL example, you know, some of those immediate things we would tell those sorts of patients after surgery, the same thing is true whether you delivered vaginally or via cesarean birth. You're going to want to remember, yes, you need some ice, you need to rest, you need to elevate. Some early walking and movement is good for you. So those really key things are important to keep in mind because it's going to set you up for success. And I find that more we know about the healing and that early postpartum period, it's going to set you up for success long-term postpartum as well.
Yeah. And I would bet that in terms of postpartum recovery, and correct me if I'm wrong, but you know, I would bet that there's some general information about those early days and what that should look like in terms of recovery. But what I'm sensing and what I've actually even heard from patients is like that, you know, that 6 to 12 week mark where you're like, I want to be doing more, but I don't feel very good doing this stuff. And this stuff is lingering, you know, that kind of thing is.
Well, Ella,
you know, mom life.
Mom life.
I know, but I love it because this is reality.
Yeah, totally.
And it's part of your passion. Is that kind of like subacute phase is in orthopedics even. That's kind of where I feel like physical therapy can be so beneficial. And I would venture to guess that in the same way, that's where the education is 100% missing in terms of pelvic health.
And I would
in
say
postpartum.
like, that's what I love. Like that's one thing that I really am passionate about too, treating is those early weeks, that 0 to 6, 0 to 12 weeks, because there are a lot of programs that start 6 weeks and after you've been cleared, this is what you should do. But I always say too, even if you've done nothing for your first 6 weeks, you really shouldn't be jumping into a program. You need to lay those foundational things, even if you're starting at 6 weeks. But if we can start doing those things day one, even you mentioned the diaphragmatic breathing, we don't really think of it as an exercise, but it's so beneficial to our bodies in getting that core system kind of recalibrated. I always say there's that period where your brain needs to start reconnecting to your body and reconnecting to your muscles. Like it's changed for 9 to 10 months. Postural changes, muscular changes, so many changes that happen that we kind of need to recalibrate, reset. We need to get that brain to reconnect to those muscles and what they feel like, what it feels like to activate again, what it feels like to turn off. I mean, the things that a new mom does with a newborn include squatting and lunging and bending down to pick up and rocking and carrying. And that's all really physical. So these smaller movements that we can tell moms to do, such as the breathing, are going to be so helpful long-term and setting you up for success to get back to the things that you want to get back to.
Totally. And I mean, like I said, I got pelvic health physical therapy after in my postpartum period. But my two biggest regrets are, one, not going during pregnancy, because I do feel like I missed out on just the knowledge of probably modifications of exercises that I probably should have been doing. And then, like you said, just like the understanding that it's not, I need a strong pelvic floor to push the baby out. It's actually relaxing and learning what that feels like. So I that's a regret for me. So I'm glad you mentioned that. And then also not going earlier. I think you hit it on the head with like, I was waiting for my 6-week appointment and being like, you know, just resting and doing the things that you need to do when you have a baby. But I do wish I had gotten started earlier, just on the most basic things and reconnecting the brain to the body, like you said. So I think that's really great that you hit on both of those, because I would definitely echo that as a first-time mom. And, you know, I only have one pregnancy to compare this to, but I think that's definitely two regrets of mine.
And I think so many times too, you know, I hear that all the time. I have my own regrets too, but you only know what you know. So you can't beat yourself up for not doing X,
Totally.
Y, Z.
No.
It's just, moving forward, now now tell all your friends, make sure that
exactly tell all your friends
making changes for the better moving forward, and be proud for when you did go to PT and the progress that you've been able to make. But it's another point, like it's never too late either. So if there's a listener out there that are like, I have 4 kids, I'm in my 40s, I'm still having issues, it is never too late. There is always progress that we can make moving forward. Even if you have that cesarean incision that you have never touched, that could be contributing to some of the back pain that you might be having, or the leaking that you're experiencing, or some pelvic floor tension could be contributing to those symptoms as well. So there's always, always time to make changes in the right direction.
That's a great point. And I'm so glad you bring that up. I feel like I hear that a lot from even some of our elderly patients is, I've just had that happen since I've had 4 kids when I was younger. And I thought, well, wow, there's something we can do about that now. I want to switch gears just a little bit and brag on you a little bit, Kaitlyn, is that in addition to being a doctor of physical therapy with a pelvic health certification, Kaitlyn is also a certified strength and conditioning coach, a certified nutrition coach, and a yoga instructor.
I didn't know the yoga part. That's awesome.
So I want to hear, what are your thoughts, because there's so many different realms there. Obviously, I would venture to guess that you treat with a very holistic, point of view. So tell us a little bit about what that looks like for your patients and how you incorporate those other things.
Definitely. So I like into your practice. I'm just a big nerd. I love learning. I love
we love nerds. So,
and kind of when it came down to it, these were all avenues that selfishly I wanted to know about, so I could better myself on my health journey. Like when I got out of PT school, I really felt that I was lacking in the strengthening, conditioning, exercise portion of things. So right out of school, that's when I pursued that certification, and it has helped immensely. Of course, for that orthopedic background, but even now, so many moms want an exercise program that I can take them from that rehab side of things and progress them into more of just the strength building side of things. And then same thing with the nutrition certification. I wouldn't say I'm a health nut by any means, but I strive for balance, like I think we all do. And I think just kind of knowing some of the basics of healthy eating habits are important for when you're pregnant and as a new mom. You don't have a lot of times, but at least knowing, once you have that baby and you're in that postpartum period, your body's recovering. Yes, we need some extra protein here and there. We need to make sure our iron stores are being replaced. And so little things like that. I usually tell my patients, I'm not going to give you nutrition advice, but I can talk to you about hydration, some healthy habits. Constipation is something else that happens very frequently. So to be able to talk to moms about how to increase your hydration, how to increase your fiber intake, what are some other fruits and vegetables to add, what are some things to take out, is really helpful to help have that very holistic approach to treatment. And then with the yoga certification, so many of the yoga poses are really beneficial for pregnancy as well as postpartum. Even if I'm not teaching a class, I can at least draw on those certain movements and apply it where I see fit. But you're right. I think, as you start to treat a little bit longer, you kind of go from, I'm just treating the knee, or I'm just treating the pelvic floor, to I really need to treat the whole person, because even if someone's coming in with a pelvic floor problem, 9 times out of 10, there's probably an issue with the hips or at the low back, or even something that's happening at their feet, that are all contributing.
Or even systemically, are they inflamed systemically? That's one of the biggest things. I feel like I've started to, again, not giving specific medical or nutrition advice, but kind of guiding patients in the right direction for resources there, because it's something I, as a young PT, I was zoned in on how do I treat this joint. And most of the time we're dealing with things like arthritis or, just a greater tendency to have more wear and tear in a body. Then we need to look a little bit deeper about why is this person more susceptible to soft tissue injuries, or, wear and tear on their spine. Of course, aging plays a role in that, but there's lots of things I think that are missed early on. And I think we're just starting to kind of venture into that more holistic
approach,
point of care approach for people. And I'm excited about that one, because selfishly it allows us to work with other awesome providers like yourself. By no means do I want to be an expert in all of these things, because I'll never have a free moment in my day with all the questions I'd be asked. But, I think it's awesome. And that's part of the reason why we started this podcast, was to just connect people to other valuable expert sources of information, like yourself. I want to dive into just like a few fun things at the end, or towards the end here, just to kind of, lighten the mood a little. But before we do that, one last question on, just give us an example of like, what would a pelvic health physical therapy evaluation look like, and maybe one example of what a consultation, like virtual consultation, would look like.
I'll
just
preface and
give us an idea.
I think every pelvic floor PT has their own way that they treat. So I think by now you all have a good idea of who I am and how I treat. So my evaluation might look a little bit differently, but it's just based on the background that I have, some of the other education I have developed, my evaluation style that works best for me. So I'll kind of preface it to say, this is what it looks like for me. It might not look the same way for everybody. So that first visit, it always starts out with a lot of chatting. So we talk about you, what your goals are, what your concerns are. We'll dive into a little bit of your history, past medical history, if you've had prior births before, what those looked like, what your recovery looked like, and then any other questions that might relate to exactly what you're coming in for. So basically, I want to know what things look like for you on a day-to-day basis. What are your goals? What do you really want to come in to see me for? And especially a lot of the things that we talk about are a little bit more intimate. So just taking that time so the patient can get to know me, I can get to know them a little bit, definitely having a little bit of time, I like to say, just for us to chat and get to know each other. Then we kind of move more into the assessment. And this is going to vary depending on what that person's coming in for. So definitely we want to look at posture, breathing. We want to look to see how your body's moving. So that might look like bending down to touch your toes, twisting, rotating. How's your spine moving? We might look to see how your hips are moving. What does that rotation look like? We might look at the strength of hips. We'll definitely look at your abdominal wall, especially postpartum. Is there any diastasis recti there? What does that look like for you? And then we want to look and see, when it comes to the pelvic floor muscles, it is always up to the patient whether they want an internal exam or not. It is 100% up to them. I tell moms all the time, it's something we don't have to do. If you're uncomfortable doing that, there's progress to still be made, but it does give us a lot of really good information about exactly what those muscles are doing. Because so many times we think we're contracting, but maybe we're actually pushing down, or maybe nothing's really happening down there. So just to get more information from that area of our body. And I always say too, it's very different. I think a lot of people think it's like a pap smear. It's not. It is very different. It's very gentle. It's relatively quick. And again, we're just assessing, can you contract those muscles? Can you do a few repeated contractions? How long can you hold that contraction for? In addition to assessing what those tissues look like, is there any irritation? Is there any tender points? That's a little bit more what that pelvic floor assessment would look like. And then based on all of those things, we'll come up with a game plan. So is it specific treatment that you need? We might need to do some soft tissue techniques, some massage, some mobilizations. We might work on those specific pelvic floor muscles if that's what's needed. But there's always a big education standpoint. So we're always going to go over what and where those pelvic floor muscles are, how that relates to the core, just so you have a really good understanding of what's going on in your body, where these things are, making sure we're on the same page. When I'm talking about the core, you also know what the core is.
Yeah. Well, and I would say, I mean, I have a personal training certification, and also have worked with my sisters, physical therapists, who have given me excellent guidance on all things fitness and exercise my entire life. And it was still a wake up call for me. I mean, there's just so much the physical cues, or even, if it's virtually telling someone exactly where to look, what to feel. I mean, that really made the difference for me. It's like, I kind of know, I think I know, but like, until someone actually points it out to you or says, ooh, that's it. It just, it never made sense to me. So
and I think
really,
that's a perfect
totally
segue. So a lot of times people are like, okay, what can you really do virtually? And right, we can't assess your pelvic floor muscles internally virtually, obviously, but there's so much that I can, but there are so
for
many,
good reasons.
being a fellow physical therapist, like our eyes are trained to look at things that most people wouldn't look for. So if I'm able to see your whole body on a screen and you are even just standing there, I'm going to be able to see what position is your rib cage in, what position is your pelvis in, what is your neck doing, what is your back doing, what are your shoulders doing, how does that potentially all relate to something that you're coming in for? Or, okay, let's look to see, try to engage your transverse abdominis muscle, that deepest core muscle. What does that look like? And physically, I'll be able to see, is your belly button drawing back and up and in? Is it pushing out? Are you holding your breath? So there's so many things that we can assess virtually just by looking at you, that most moms do get a lot of benefit from doing a virtual appointment. And you don't have to leave your house. You don't have to find childcare. I've heard from so many moms, they're like, I was scared to go in person to see a pelvic floor PT. So I'm like, at least I'm giving you that information and education, because so much of what we do is just education. It's not like I'm going to tell you monumental things that you've never heard before. But if I can clue you into maybe a certain way to bend down to pick up your kiddos, once you do that 100 times a day, if you're doing it with proper form and mechanics, you might not have as much back pain. That's our goal. That's what we want to get to.
Yeah. Well, and I would say also that there's education out there. It exists on Instagram, on Google, on everywhere, but the actual having a personalized person watch you is such a game changer. Because I mean, I accessed all that stuff after pregnancy or during pregnancy and think, oh yeah, I'm doing it right. That this person on wherever said to do this. But until you have someone look at you specifically, and I think we talked about this, Kaitlyn, it's like, it's just not the same. It's like, it's generalized versus personalized, and that personal approach is going to help you so much more.
I think that's the physical therapist vendetta, is if we can convince everyone that, it just because you're receiving that general information that works for maybe a majority of the population, but if you have specific things going on, you need individualized. Exactly. You need someone to look at you with that fine-tooth comb to say, oh yeah, I mean, they're not going to catch this in a general piece of information or education, a video you might find on YouTube, but I'm looking at you and I see 6 compensation patterns here, which is going to cue me to look at this spot. But I really appreciate you giving us kind of a rundown of what that looks like. I think such a big barrier for entry. I know even just in trying to talk to some of my friends and convince them to see a pelvic health physical therapist is, they do associate it with what it's like going to your OB, which is highly unpersonalized a lot of the time. It's 15-minute appointments where you maybe get a hello before, you're getting internal exam, and it feels a little threatening in a way. And I think it's important to acknowledge that. So I love that you talked about how much of the session is just you guys getting to know each other, getting to know what that person is looking for. I think that's really important when you're developing a solid therapist-patient relationship, and someone that you could trust to go back to, not just for this pregnancy, but maybe the next one, or maybe during the postpartum phase. And so I think that's really key. I want to give you, I have a few fun questions now that we'll kind of end with, and then I want to have you kind of give our listeners information about where they can find information about you, and maybe a couple exciting things that I know you have going on right now. But okay, so first question is, what are 3 kind of tidbits of information you'd want people to know, either about pelvic health physical therapy or about pregnancy and postpartum and their bodies?
My first one would be
your top 3.
Find a good support system. So this might look like your immediate support system of your partner or a close friend or someone that's going to be there for you no matter what. This also looks like your potentially like your birth team. So this could be your provider, making sure you find someone that you like, whether that's an OB, whether that's a midwife, knowing that you have options for those individuals. I heard a mom the other day who had an OB. She didn't really feel connected with him. And after hearing her birth story, it was less than ideal. And I think that little voice was in the back of her mind saying, find someone else, find someone else. So it is always your choice on who your OB is. Do not feel bad switching providers. You want to surround yourself with people that you feel confident with. So this could also look like personal trainers to help you through this phase of your life, chiropractors, acupuncturists. And I know a lot of times when we talk about these different providers, it can get expensive, but you would spend as much money as necessary on your baby. If your baby needed something, you would spend the money on them. The same thing should be for you. Invest in yourself, invest in this time of your life. You want it to be a positive experience that you can look back on. So just surrounding yourself with all of those support systems, I think makes a huge difference. Number two, when we kind of talked about this already, is it's never too late. So whether you are 9 months pregnant, whether you are 9 months postpartum, no matter where you are in the journey, it is never too late to seek out treatment, to seek out help. There's always things that we can do to improve, to make your symptoms better, to give you a more positive experience. And then number three, I think to just kind of change your opinion. Just change your mindset on what pelvic floor PT can look like when you're going to a cash-based provider. Because so many times I think we think of PT for an injury that I'm going to need to go in and see them that 2 to 3 times a week for 4 to 6 weeks. But this really can look differently. It might only be 1 visit. That might be all you need. That might be all you want. It might be 6 visits. But it can be whatever you want. It is up to you what that looks like. Obviously, I'll give you my recommendation for what I think would be best for you to meet your goals, but it's always up to you. So I think so many times it's like, oh man, I'm making this big commitment that I'm going to need to see you all the time, but it doesn't have to be like that. It can just be here and there as you need things. It might just be that 1 visit to get a ton of education before your birth. But I would say most times after we do that 1 session, it's like, yeah, you're right. I probably should see you for something else or down the line, or at least to check back in. So just, changing the mindset a little bit of what PT can look like.
You smashed that question. You nailed it. I feel like all of those were perfect answers, and just things that I think everyone needs to hear. Okay. And then this is the trend I've seen recently, but what is one piece of advice you would never give to a client? We'll stay in the realm of pregnancy and postpartum. What I'm going to put my own little spin on it.
So I am a physical therapist who will never tell you not to necessarily do an exercise. So it drives me crazy when there's a list of like, don't do this, do this. Maybe you really want to do planks. Okay, let's talk about what doing a plank looks like for your body. If you're able to do it, you're activating the right muscles, you're not feeling any pressure anywhere else, perfect, you can do planks. But if we look at that plank and we're seeing some coning or doning of the abdominals, meaning those abdominals are kind of rising up, which is a sign that there's too much pressure going through those abdominals. All right, let's take a step back. What's the goal of a plank? Why do you want to be able to do a plank? Do you want to be able to do a plank because you're trying to work on your core strength? If that's your goal, let me give you a different core exercise that it's going to better target those muscles while still maintaining your abdominal integrity, so we're not putting excess pressure through that abdominal wall. So I always like to say, I know why people give that list of sit-ups, crunches, planks, because yes, in general, those things do put more pressure through your abdominal wall. But if you want to be able to do those things, let's take a peek of what your body is doing and either make modifications so you can, or let me give you a different exercise that's still achieving that same goal.
Yeah. And
guys, and if you're listening, this is the definition of individualized care and why you need to seek out a physical therapist, because it should always be related to your goals. Sorry,
no,
Karen,
I was going to say she definitely practices what she preaches, because I remember in a session, I was like, well, I'm just not able to do like a hollow body hold yet. And she's like, okay, so let's look at that. And, you know, I just wasn't strong enough. And she's like, so why do you want to do a hollow body hold? And I'm like, I don't want to do a hollow body hold. I've always hated hollow body holds. So it actually helped me resolve, that issue. I mean, she gave me plenty of other exercises that work to the same muscles that I could definitely maintain with better form. But it was just it's funny that you say that, because I distinctly remember being like, I hate hollow body holds. I don't want to do them. So thank you.
And a lot of times people will equate,
but there's that education piece.
Was the only way to make my core stronger, or I don't know any other exercises for my core. And so a lot of times that is the case. It's like, well, I just thought I had to do planks because that's the only way to work those muscles.
Yeah, definitely.
Okay, well, thank you so much for sharing your time with us. Before we end this, I want you to tell us, you have some exciting stuff in the pipeline, or already up the pipeline, for your business, Thriving Mommas. So give us a little bit of a rundown on that, and then where can we find out more information on you and your services and all you have to offer?
I'm like, what is going to make a mom's life easier, better, more helpful? So I just launched my pregnancy 4-week workout digital guide. So this workout guide is 4 weeks,
that's awesome.
3 workouts a week, upper body, lower body, and full body, minimal equipment, only takes 20 to 30 minutes. I wanted something to be kind of quick and easy that could either be used as supplemental to something that you're already doing, or if you have zero time, you can at least get this in. But the exercises, they're very functional based, and it kind of hits all the main things throughout pregnancy that you want to make sure that you're keeping strong, in hopes to prevent some of those really common aches and pains. So for a lot of the upper body exercises, it's working those scapular muscles to give you nice, strong arms, so you're not getting that upper back and neck pain from all the carrying and feeding and all the things that you're going to do with your kiddos. Lower body definitely incorporates a lot of the hip strengthening exercises. And then a lot of the core strengthening is kind of throughout all of those, and some specific core exercises in that full body. There's stretches in there. I, of course, made sure to include some education at the beginning as far as what modification, I tried.
Guys, she's thought of it all.
It's got it all.
She's thought of it all.
I was like, what would help me personally out? What would I be looking for? And then I was able to make this guide of, if I'm wondering these things or trying to do them, I'm sure there's other moms out there who want something as well. So that is currently available. I'm currently fine-tuning the postpartum guide, which will be a similar setup, the 4 weeks, 3 specific exercises, but that's more targeted towards postpartum. This guide is designed to be done after that 6 to 8 weeks postpartum phase, because it's a little bit higher level than what I would generally recommend in the first few weeks. But I will be working on a 0 to 6 weeks, some sort of program of sorts that will be coming.
Of course you will.
I am very passionate about that, and I feel like there's really not a lot of resources during that time frame. What else?
Definitely not.
In-person consults will be starting back in September. I have an office in North Scottsdale, and I will be there Monday, Wednesday, and Friday. And then virtual consults I am doing currently 5 days a week, just kind of wherever works for you, wherever works for us in our schedule. Ella usually hops on, my daughter, those consults as well. But people looking to schedule, my website is thrivingmommas.com. I'm on Instagram at thriving.mommas, and mommas is spelled MOMMAS. So I definitely respond to my DMs more than I do my emails, but my email is hello@thrivingmommas.com.
She does.
So There's all the handles. If you want to schedule, feel free to email, DM me, and then we can kind of go from there. I also, last thing, offer discovery calls, which is just a free 15-minute call to ask any of your questions, kind of get to know me a little bit in my treatment style. So that's always a possibility before scheduling as well.
Awesome. Well, we will link all of the information about your pregnancy and postpartum guides in our show notes, and your website, your Instagram page. We're giving them all the resources to lead to you, Kaitlyn. Yeah. Thank you so much for chatting with us. You know, you're a great friend in the business for us, and just
thank you.
Unbelievable wealth of knowledge. And we're lucky to have your expertise. So thank you so much. And everyone, reach out to Kaitlyn if you have any concerns. It's never too late.